My name is Maxine, and I was diagnosed with non-Hodgkin's lymphoma in 2009.
And my name is Dave, her husband, and I've been with her for the whole ride.
Well, I have had cancer 3 different times. It came back. And then this last time for the CAR T, I had a lump in my left thigh. And I went to the doctors and they did a biopsy and found out that it was cancerous.
Prior to the CAR T, Maxine had a stem cell transplant. And the stem cell transplant held up for a while, of course, but then that lump did show on her left thigh. And so we're looking for other therapy vehicles, and that's when the CAR T was mentioned. We went up there and saw them, had a consultation, and they explained to us what the CAR T was, and we both agreed with it, and we went forward.
We had to travel to Rochester.
It's about 90 miles. Thankfully, it wasn't much of a complication. Wilmot Cancer Center, which is a part of Strong Memorial Hospital, they have an affiliation with Hope Lodge, which is an American Cancer Society housing place for cancer patients. So we were able to get a housing there with them for the duration of Maxine's treatment. So thankfully, we only had to provide our own meals. Obviously, that was a great boon because financially, without them, we couldn't have paid for housing for that extended a stay. But so it wasn't a problem, thanks God. I did, prior to the treatment, once we knew that this is what was going to be happening, I did take on a part-time job because I knew it's going to be costly food-wise, about 6 weeks, 5 or 6 weeks. Thankfully, because of our income level, they wrote off any patient responsibility. Whatever our insurance did not cover, they wrote it off, which of course was a blessing to us.
Yes. We talked with the team, which is the doctor and the nurse, and they explained to us how the CAR T was going to go and about the side effects, and how long, I would be in the hospital for the whole procedure. Well, they put a catheter in for the apheresis. It took about 4 hours for them to do that, to take the blood out and then put the other blood in and send it off for 17 days to California. And then when it came back, I had to go into the hospital. They said it was going to be 2 weeks.
The day of the injection, they had to warm the blood, putting it back in because it was refrigerated. And she was okay for about, I think it was 2, maybe 3 days after they infused her with the blood, put it back in her. After that, for lack of another term, a decline started. As far as the side effects go, well, Maxine, of course, doesn't remember them, and we were told that she wouldn't. As the caregiver, I have to emphasize that explaining did not prepare me for what actually happened. It did not prepare me. I was not prepared to see my wife go through what she went through. And I first noticed it when I asked her, was she hungry? And she just looked at me with a blank look. My wife was like, for lack of another term, a zombie. She didn't recognize me, the care team, anyone.
My doctor, I did not recognize him.
And she would lay in the bed and she would go through this rocking thing, back and forth, based on what they tell me. She had one of the really severe reactions to the treatment because, frankly, I was afraid I was losing my wife. This went on for like that about a week. And I can't describe how terrified I was watching her in that state. And then she gradually started coming out.
I found myself, every now and then I was crying.
That was when she was coming out of the neurotoxicity. During the neurotoxicity, no, you didn't cry. You were just there like a zombie. That's the way I can describe it.
Right, because I really don't remember a lot.
Thank God.
That's why Dave, I let him do most of the talking because he was there, he knows, and I thank the Lord for that.
But even to this day, there is some memory loss. Not a lot, but on some things, you know, I find myself mentioning things to Maxine. For example, we used to play free cell. It's like a solitaire game on the computer. And Maxine was extremely good at it. She doesn't remember it. Just recently, she started back to remembering it.
And to this day, I still go to the oncologist, hematologist every 3 months or maybe 4 or 5 months to get my blood checked.
The results of the treatment are wonderful. Really, I mean, really wonderful. I mean, when Maxine had the stem cell, we thought we were done. And then he came back. But this time around, so far, like I said, we're at the two-year mark. And as of last week, the CAT scan she had last week, she's still clean and clear of cancer. So, you know, it's worth it. It was worth it.
Yes.
It definitely was worth going through that.
Yes.
Yeah.